So like Dr. Wiebe said, my name is Danni Pinnick. In the interest of disclosure, I actually work for North Dakota Health and Human Services, and I've had the pleasure of working in public health for about the last 10 years, helping other families and healthcare professionals be informed and comfortable with vaccination. But today, like you said, I'm going to speak about my experience as a mother to a child whose life was really affected by one of these diseases just a couple of years ago. So in October of 2022, just a few days after his third birthday, my son Judah became sick with what started as a mild illness, a fever, runny nose, and this progressed over a couple of days into difficulty breathing and really extreme lethargy, dehydration, refusal to eat. Some of those really scary things that can happen as a parent to your child. And as a parent, like when your child is regular sick and you can just kind of help them at home with some TLC, snacks, cartoons, and everything. But this was definitely at the point of go to the doctor sick. He was, getting scary sick after a number of days. And so we did take him to his doctor. We're really lucky. We live very close to our pediatrician. So we took him there, and he was seen and diagnosed at that first appointment with RSV. So we knew that's what we were dealing with at first. And that was really not a huge surprise to us because we knew that RSV is something that affects young kids. We were a little bit surprised that at his age of 3 years old, it's something we associate with really young babies, that he had progressed as far as he had. So his doctor also did some x-rays that day to rule out a more severe pneumonia and make sure that his lungs were not sick in that way. But really we were just concerned about his breathing, number one, and then his dehydration and his lack of food and just those really severe symptoms that he was having. The next maybe day and a half, we took care of him at home, which was a kind of a scary process because, when your child's not improving, even though they're getting pretty advanced at-home medical treatments like a nebulizer and really strong steroid treatments and things weren't really getting much better for him. His oxygen was still staying pretty low. So at that point, we took him back to the doctor, and they did some oxygen therapy for him at that time and found that even on positive oxygen, he wasn't really able to keep his oxygen levels high enough. So he was actually hospitalized that day. At that point, hospitalization is a really scary thing for a parent. I grew up with a mom who's a nurse, and I really, trust medical providers. And so it was really a relief to us at that point to get to have this awesome medical care and treatment that he was then brought into. And that stuff that we're doing for him at home could be done by professionals who were able to really make a huge impact on his improvement and make him a lot more comfortable for the next couple of days. He went on to be hospitalized for about 3 more days at Sanford Children's Hospital in Fargo. Like I said, it was a huge amount of care that he was given during that period of time. Like Dr. Nagpal mentioned, the beds that we have in North Dakota for children's hospitals or adult hospitals are limited. So we were very lucky in this case that there was enough care to go around, that he had a lot of the hospital was not extremely full at that point. I spent a lot of time thinking over those few days about everything I was really fortunate for in that circumstance, and that he was actually maintaining and kind of turning a corner and able to get IV fluids when he wasn't able to really eat or drink. And so luckily he improved over the course of a few days, and we knew that he had turned a corner physically and emotionally when he was actually willing to eat something and started to request food. And I'll never forget the first thing he asked for was pancakes. So I knew like, okay, he's going to be fine. He's finally willing to eat. It was probably, a full week or so that he had so few calories or really ability to really even eat anything at all or really drink anything on his own. So that was a huge relief for us when he started to come out of it. Like I said, my family is really lucky about so many parts of the story. Like I mentioned, we live in Fargo, just a few miles away from our pediatrician and from the hospital where he stayed. We have great support at our jobs and our families. This helps us carry an emotional and financial load of a situation like this. We were really lucky in the situation that Judah is a mostly healthy boy. He doesn't have any chronic conditions like we've heard about today that can really exacerbate a condition like this when you get sick. He was born at full term. He had time to develop his lungs. And that, like I said, he was 3 years old when he got sick with this. And so, if he had gotten this at 3 months old or something, this would have been an even more harrowing story for me that you'd be hearing today. And then finally, I wanted to end with some good news that we just celebrated his 5th birthday on Friday. So he's totally recovered, went on to, be very healthy and have very limited effects from that hospitalization. But this is a really scary, emotional, it impacted our life in a huge way for a couple of weeks. It's a financial impact, although that's, low on the totem of things that you worry about with something like this. But it's just, it's so much easier to avoid a really severe illness like this with some of the free prevention tools that we have, like immunizations. I also wanted to say I shared my story today to advocate for families who are not as lucky as mine. I've heard a number of stories from friends and colleagues about kids that have gotten sick with RSV or other respiratory illnesses who don't live, in Fargo, who live in a rural community or live in like a reservation community or something, and have to travel so much farther to get hospitalized, and have really been sick to the point where they absolutely should have been hospitalized, but maybe didn't have that level of access. When these things happen while hospitals are really overburdened, this can be, a matter of thinking about, is there room in the hospital for these little kids? And so we really counted our blessings after this happened, that everything, as terrible as it was, that it honestly went pretty smoothly for us. And we know that many stories are not as fortunate or as privileged as ours were to kind of come out of a situation like this with a fully healthy child, and some kids succumb to these illnesses. One of my first thoughts when he got sick also was a hope and a wish that there would be more prevention against RSV in the future years. I was really, it was really kind of incredible indicator of how far our scientific community has come, that within, a year of when this happened to us, that there were all of these prevention tools for RSV. This is especially meaningful for me to talk about this year because in the last year, both my father-in-law and my mother have been diagnosed with cancer as well. And their situations are pretty fortunate as well. They're in treatable stages, they're going through that. But it's really important for them that we all see our impact in that we have in our community, and staying, being immunized against these things, and keeping our neighbors safe from these sorts of diseases. And now my wish is that everybody who's eligible receives one of these important immunizations before RSV, COVID, or influenza, or pertussis affects your family like RSV affected mine. So thank you for listening to me today, and it was really a pleasure to get to talk about this, like I said, with the thoughts of my healthy child who has survived this experience and come out perfectly healthy. So